Namaste. Myself Dr. Samya Vilayawat. I'm a chief consultant at Diabetes Reverse Obtaining Bible. I'm over here today to talk on a topic, diabetes and podiatry. Podiatry has become a specialization. We started really an eye-catching specialty since the time the diabetic foot issues have started more in a diabetic community. I would say podiatry means it is understanding or diagnosing or treating the foot-related medical conditions that would involve the foot and the lower part of the body or extremities that would include the toenails of your feet. So that is a system. I mean that is a specialty where we got it as podiatry and we got the person as a podiatrist. So how does it is related to diabetes? So majorly whenever a person is diabetic, most of the complications, the foot ulcer, that is the one which is taking the maximum hospitalization of diabetic patients. So generally, any disease has its own stages. And we do say most of the diseases can be managed on an outpatient basis. And there are few diseases which definitely attracts them to a hospitalization. I mean, where the patient has to be admitted and treated. One of the diabetic is unless they reach to a renal issues, that is a diabetic complication. Then it is when they are put over dialysis, then also it might drive the hospitalization in related to diabetes patients I'm talking. Otherwise, we are seeing the hospitalization of diabetic patients is more with the issues of the foot ulcers. So let's understand how is that to manage this particular podiatry, or how to make sure that the hospitalization can be avoided, or what exactly the causes and how we can prevent this. So let's start with the how can we prevent or manage the podiatry. We generally say that as a general diabetic patients who does that, we should always be active, regular activity should be there. Especially, I would say that the post 60 or 70 years old diabetic patients who are being staying themselves for keeping themselves inside the room. They really won't go out. They don't have a social life, or they're not working anymore, not even a part-time job. Then you have to be very careful because you start covering up, keeping yourself warm. In that thing, you forget check your foot or make an examination frequently. So for them, I will always say you should always keep a physical activity and you should expose your body to the sunlight. That's a one thing we have to understand. And the second thing is you can always get a basic test. That is what we connect as ABC. Find your A1C, your blood sugar, blood pressure, and the cholesterol. So your sugar levels, your blood pressure, and the cholesterol. These are the three things we should get. These alarm sometimes, at least I would say 80% of the patients would get an alarm. If that is the values of really not good, then you have to be some sign. That is something which is really going wrong in your body. Right? So then the last thing is you should always have a well-balanced beef diet, which I've been now covering up it in most of my diabetic videos. And how to take care of your diabetes podiatry. It is like growing your three things. You should always check your feet once a while, at least once a day. If not, alternative days, you should always check your feet. You should sit yourself in sunlight and check in between your fingers, the foot fingers inspected, and try to scrub and clean the dead tissues. Use self scrub or dish also make sure that you are not exposing that enough the own water for a long duration, or you're not getting exposed to any kind of detergents or washing the bathroom. Then you have to cover up your legs and then do it. So those are the minimum precautions you have to take it, and always make sure whenever you attain bath or whenever it is exposed to water, make sure it is important to completely dry or clean your feet properly. So, during the winters, you can also make sure to stop laying over that oil at night. That would just keep your body the best moisturizer. I mean, instead of any other moisturizer, we might probably suggest a coconut oil. So, what are the complications with the podiatry, if you ask me? Before that, like we just tell no feed symptoms of diabetes podiatry. Major symptoms, I would say it's a common. Sometimes patient gets confused with the diabetic neuropathy also. They will also have a burning sensation and a kind of burning or numbness, or completely you feel something is broken, and that would not be for a long time. It will be for a few seconds, or sometimes it go up to 10 seconds also. You should always keep that observation. And sometimes you will have on and off severe dryness and itching at that particular time, and generally at the night is what usually it does. And they would also start seeing some discoloration. The color might start changing. Sometimes the viewers, and if it is kind of a winter season, or if you're staying at really a cold place, countries, then also the reasons could be other. But yes, the color changes, or some people will also say that there is a reddish, like dark rash, right? It just comes and goes, results itself. That is also we call it as discoloration. And sometimes the temperature variation, up your food and real your food. That's burning is different from the temperature. Like whenever you touch, then you will be able to understand. It could be like very cold feet. Sometimes you feel it is quite warm, and also some people will also keep getting the sores or the fungal infections repeatedly, and they will also get cons, that hook cons, what they get, even though they get what remove fertilization, still it keeps repeating frequently. So these are the signs and symptoms. There is something happening with your food. And next comes to be the complication. The major complication, I would say, at least foot ulcers. So diabetic foot ulcers, if there's a one small impact is enough, which would lead you to foot ulcers. And if it gets infected, that's the time your podiatry has really plays an important role in that, because if it starts not healing, then the final complication of that particular diabetic podiatry is to end up without amputation. So this is the final complication baby would reach. So it's always when I just refresh the points for you. First thing is always keeping the hygiene of our food and clean. And you should always look for the color changes whenever you check. That's an inspection. You should inspect yourself. Is there any color changes? Is there any numbness or burning sensation or corn or cuts or the fungal infection? And whenever you use the water, that you have to dry a piece. This is the one thing of taking care of observing yourself. Second thing is the basics of diabetes. Whatever we tell you is to keep yourself active, keep walking, so that will increase the blood circulation. I mean, cardio is the best cardio. I mean, walking is the best cardio, which would help you for the better circulation of your foot health. And making sure you're keeping your area very moisturized, and having both a lot of hydrated or a few foods along with the proper protein foods and carbs, the required amount, and keeping your sugar levels, blood pressure, cholesterol under control. If you are able to do all these things, then yes, you don't need to worry. But why I happen to speak on this particular topic is whatever the patients are getting nowadays, they say like they always had a controlled blood sugar and their BP or cholesterol. Everything was normal only till they got that particular cut. It was just a mistake, or they happened, it was an accidentally, or it itself started becoming dry, and then the blister has happened, and that opened up, and that converted as an wound, and which went up like a tooth. It ended up like a foot ulcer, and it start getting infected and infected. It can be only of your toes, sometimes all the fingers, sometimes the complete. So then it could start of going towards your ankle and the leg part. So when it goes, there are people who also started the cellulitis. Then they convert as a foot oil. So we have seen those kind of cases also. That is like they still just start with dry skin. So you should always be aware of that also. You have angry at the neck part starts just itching and quite a dry skin, and then it starts changing its color. They say like the doctor, whatever I outweigh within an hour, whatever the kind of moisturizer I apply, within an hour or two, I start feeling the itching again. So you have to make sure, and that's what I told is the apply coconut oil overnight on your extremities, nicely, gently massage it and leave it. Or if you're not a person comfortable to stay with the oil, just apply 2 hours before your bath and then eat with. And then you can use, I try to avoid, more the diffusing greased sauce, which makes your body feel dry. So if you are able to so precautionary with all these things, then you would never end up with any kind of bacterial food ulcers. Then definitely you will need a hospitalization. So this is about the one topic, diabetes and podiatry. So I'll be covering up on that. I've already covered few of the complications related to diabetes in my other videos. Thank you.